Steve, there's been some Republicans talking about President Obama's health care plan. I guess for lack of a big word, that it's a bad idea, that he's trying to rush through a bad idea. Earlier in the week, President Obama is saying that he really didn't even understand certain provisions of it that seemed pretty important for the future of all of us, private, people in private businesses that have health insurance. What's your take on all this? Could this be his Waterloo if he doesn't get this passed? Because there's some Democrats right now that are waffling.
This is the point in the first term of the Clinton administration where we had a very similar political dynamic. People were tired of the Republicans after Reagan Bush. They wanted change. Democrats had total control. And things started out well. And it was Hillary and the secret meetings and redefining health care and the government taking it over that the Republicans finally found the issue where they could stand up to a popular young president. And that eventually sowed the seeds, along with the House banking scandal, along with the Brady bill, and then the contract with America, that essentially sowed the seeds for the Republicans having historic gains in the '94 midterm elections as the public sort of had a populist revolt against big government. So I don't know that we're at that point of this being a Waterloo kind of a moment, because frankly the Republican Party nationally is in dramatically worse shape than it was in back in 1993 and 1994. But I do think we're seeing for the first time the momentum of the abomination known as the Barry Soetoro administration. We're seeing that it's hit a major road bump, John. And it's not that the Republicans have been successful in thwarting this. It's largely been many Democrats who are probably going to face tough re-election bids in the midterm elections who sense that already they're spending more money than a government has ever spent in the history of this country. And we're barely, he took office January 20th? We're barely 6 months into his administration. We're confiscating whole industries. We're redefining a lot of things that a lot of Americans hold dear. And there's, I think, probably a palpable sense amongst Democrats that are up for re-election next year when Barry Soetoro is not, that they've got to put the brakes on. It's too much, too fast. They're moving the American people further to the left at the pace they're on that they're just not ready to accept yet. And I think there's also this aspect of it. He can say all he wants that it's just a public option of insurance, that we're not going to take over. You can keep the health plan you want if you like the health plan you have. And he can keep saying that all he wants. Either he is mind-numbingly ignorant about the nature of free market economics, which is quite possible, or he's lying, which is just as possible. Because here's what happens if you have a public option. Because it comes from the government, John, it will be cheaper than the private option, because the government doesn't have to make a budget, doesn't have to worry about paying its employees top dollar against competitors, doesn't have to worry about honoring its own, government standards of doing business that they impose on private businesses, doesn't have to do any of those things. Because of that, it'll be a cheaper option because the cost of doing business for the state is cheaper than it is for the private sector. They don't have shareholders that they got to please. They don't have dividends they have to pay out. And if they run out of money, they don't file for bankruptcy. They just kill trees and print more paper. That's what they do. No private business can compete with that. So what you will see is you'll see large companies, maybe like the one we work for, Clear Channel, one of the biggest companies in the world. It's bigger than Sony, John. Clear Channel may simply say, why are we paying all these employees health insurance? Why are we doing that when if we took it away, they would qualify for the public option and could get it basically for what they're getting it now and pay for it directly themselves. And that's exactly what you are going to see happen, mark my words. So he can say that, hey, it's just for the uninsured. They tried this in the People's Republic of Massachusetts with Willard Mitchell Romney, his plan. And you know what the result was? Exactly what I'm talking about. It has destroyed healthcare, private healthcare in Massachusetts. I agree the system we have now is very, very flawed. It's disease care. It's not health care. It does very little to encourage preventative health. And basically they're raking you over the coals, and most of your HMOs suck balls. I totally agree with that. I'm part of the system too. But I know this. The answer to you not having enough freedom and spending power isn't to give you less freedom and less spending power. That's not the answer. It will simply make the problem we have now demonstrably worse, which is why not only did Mr. Soetoro admit he doesn't even know certain provisions of his plan, but he also said at the White House the other day, maybe it was a Freudian slip, that his new health care plan will create inefficiencies in the system. Truer words were never spoken.